Hi guys, Dr. Sammy here. Thanks for watching our different social media platforms, and today we're going to answer one of the questions that was asked on Facebook and Instagram. One is from Claudia and the other one is, she has 3 terriers. So this is for you guys. Basically the question is, my patient at home has some underlying allergies. What can we do at home to kind of help with that? So very good question. We get that all the time, and depending on the seasonality or the time of year, we see a lot more allergies or a lot less. And those allergies will cause different triggers in different breeds depending on what they're predisposed to. We're going to keep it a little simple and backtrack a little bit, and we're just going to kind of focus on the pruritus, which just means itchy skin, and that's what most owners will pick up on. So easy things are, try and keep them clean as best you can. I don't want you to over-bathe them. Don't bathe them more than every 2 weeks. If you do that, you tend to dry out the skin and you break what's called the skin barrier. And then you get all the little microallergens and pollens. And when you break that barrier, you get cracks, and those pollens and things will get in those skin cracks and exacerbate an underlying allergy. So not ideal. Here at Eastwood, we use a lot of different topicals for some of those. We'll use something called Episoothe a little bit. You can try some of the oatmeal shampoos and things. I do think they are soothing and do help, but sometimes you need a little bit more, and every patient will be different. So I think omegas, the fatty acids, are pretty good. And what I'm actually after is something called the EPAs, not the actual omega fatty acid number. Our patients, the EPAs are what we're after, and depending on which study we reference, there's a huge range on what a canine feline patient should get out of those supplements, the omega supplements. But they do help. I believe I've read over 300 different metabolic processes, so it's not specific for one problem, but it does help a lot of anti-inflammatory skin barrier issues, and it does complement allergy treatments very, very well. So that's an easy thing you can try and supplement. Just don't buy crappy stuff for it. Buy high-end good stuff, and I'm actually after the EPA in those omega fatty acid supplements. And we've had good results with the ones we use, so just pay attention to that. The other thing I always have clients pay attention to is this a year-round problem or a seasonal problem? Right now, it's springtime. There's a lot of winds here in El Paso, and spring, which means things are growing, more pollens, more allergens. Allergies are going to flat out be worse this time of year than they are at different times of the year. And some of that's environmental, and that is just flat out of our control. There's nothing we can do about that. We'll do different topicals, like I said. We'll do what's called multimodal, which means we'll do topicals, sometimes we'll do injections, sometimes different tablets. Another easy one you can try that is very safe for the vast majority of patients is over-the-counter Benadryl. And might get a little sleepy, but it's a very, very safe drug. And I've had patients where that's all they need for those seasonal flare-ups, and they do great. I've had other patients where they did great for a couple days, and then it doesn't help them ever again. So there's a huge range, and as we work our way up the ladder, we'll get to some of the more stronger hitting medications from the veterinarian. But try those things, see if that'll help you guys. And if you can find those triggers, like you have a mulberry tree, maybe try and avoid that or keep it as cleaned up as you can, because we have a lot of mulberry allergies as people, so I imagine our canine and feline patients do as well. So hope that was useful for you guys, and a few little tips to try for over-the-counter stuff. We'll see you later, guys. Bye.